So we stopped here. So many things will affect our brain, both in good way and in bad way. Okay. So need some help. It's not working again. So see here, come here. Okay, good. So based on a combination of good and bad things, we lead our life. Okay. So uh, in some countries, uh, women, when they are pregnant, they drink alcohol, they smoke, and they eat fatty food. They become very obese. Pregnant women. All the all these things which mother is doing will have an impact on the baby inside the stomach, inside the uterus. When child's brain is being developed, all these things will affect. So when children are born, you know, you see, boys boys developed aggression, like I'll go and hit somebody, and girls developed anxiety, fear and anxiety, tension, and impaired. No, suppose if somebody needs any help, some will come to help, others will not come because they're not. Their brain network is formed in a different way. So what we see in society, problems, children misbehaving, children having criminal tendencies, lot of behavioral problems. Children are resorting to some bad things in society. Sometimes they murder, they do all sorts of things. It is not their schooling and learning. It is even before they were born, they had all these issues in their brain. Children, if we don't sleep, nowadays they just hang on to their cell phone, gadgets, games, social media, and all those things. They don't get proper sleep. When they don't get proper sleep, all sorts of problems they develop as they become adolescents. When they become teens, young adults, they develop all sorts of problems, all because of impaired sleep. If there is no proper sleep, I'll come to the sleep. Sleep is very important. Sleeping is not waste of time. Sleeping is a lot of good things happen during sleep. I'll tell you about that. If, yeah, multiple factors will influence. It's not a, b, or anything. All things combination. So you see, the brain network, also is keeps changing with age. Young people networks are different, elderly people networks are different. This is even smokers. When people smoke heavily, you see, the red is smokers. The fast, the brain speed, like computer speed, is of course it comes down with age, and it is falling down rapidly in people who are habitual smokers. Even even see, uh, you came in the morning after breakfast. Suppose if you are fasting, your brain network is different. If you eat heavily and then sit here, you will fall asleep. So, all things, food, this is even food also, the brain connections are different with people fasting and feasting. This is one of the most important factors in health, brain health learning. This is loneliness. If a person is lonely, there is a higher chance of dying early. The risk is more than alcohol, risk is more than smoking. Loneliness is very major risk factor. Even a person is say I'm using social media, I'm using internet and all those things, also can be lonely. He may not be connected to others. In a big crowd, suppose some 1,000 people are singing and dancing, person in the middle also can feel lonely. He is not connected to others. So that connectivity, that I mean, in India we are fortunate that we have families, we have bonding. Uh, 2, 3 generations of people live together in the same house. So we are a lot more connected than isolated houses in the West. See, this is one of the biggest risk factors, poverty. You know, children who come from impoverished families, we can't expect them to excel in mathematics and science and all those things because they're just struggling even for survival. See, poverty is defined as income to needs ratio of less than 1. I'm sure uh, uh, maybe you can say a few words about this. I'm sure in the state of Kerala, both governmental and non-governmental organizations, they take care of children. If little bit of support is provided to children who come from the vulnerable families, we can actually minimize the crime in the society. If left unattended, some of these children will become antisocial elements. When they grow up, they become violent, they become aggressive, they resort to all sorts of problems. Later, if you send police and arrest them and take action, it's of no use. So we have to act very early so that we can prevent a lot of problems. You see, pregnant mothers can take care. Young children can take care. People from poor families can take care. This is stress and anxiety. There is stress for everything. See, stress is good initially as a challenge, so it will have positive effect. Somebody is challenged that you cannot score 100 out of 100 in mathematics. If they take it as a challenge, they will learn, they will put extra effort and all those things. But if it becomes a chronic, you see here this anxiety, fear becomes anxiety. Anxiety is a sustained fear over a period of time, and body response to stress also is different. Initially, we have one part called adrenal gland just close to the kidney, and the adrenal gland has got an outer part and an inner part. So the early stress response, chronic stress response are different. The chronic stress response, actually it will secrete some hormones called adrenocorticotropic hormones. They actually damage the hippocampus. You see, from this adrenal cortex to brain connection, they damage the hippocampus, and because of the chronic stress, hippocampal neurogenesis will come down, and then they develop problems in remembering things and learning. Of course, alcohol. When people drink heavily, they'll have a lot of cells in the hippocampus die. And when they stop drinking, new cells are born. So in between the binge drinking, people will recover in this one. Even when mother is drinking alcohol, pregnant mother, even fetus also will have effect of alcohol. It is known as fetal alcohol syndrome. You can do Google search and then find all this information. Also, substance abuse. People who are addicted to this, all these cannabis, ganja, all those things. Initially, short term, they think they are doing good. Somebody who is singing thinks that he sings better. Somebody other studying, they feel good. But over a period of time, they will have loss of neurons and impairment. Of course, you all familiar with this internet and social media now, A to Z, they're keeping children, young adolescents always busy with all this social media. See, this University of Texas, they conducted one experiment. They made one group, there's no cell phone. Other group were allowed to have cell phone, but they're not using their cell phone. Cell phone is silent and then kept down. So cell phone is actually not working. But when cell phone is in front of their eyes, which is not working, which is closed, when it's just within, they can see the phone, they are not using, still they didn't perform well. Such is the destruction of this phone. Of course, in MHANS, there is a special clinic is there to help children, adolescents who are getting addicted to internet, to gadgets, and to all the social media. Now, these are all bad things. Now, the good things I'll tell, few things quickly. So, these are all good things: exercise, diet, music, meditation, sleep. Okay. Now, this all these things are not opinions. They're all based on experimental. You see, these rats were subjected to exercise, different types of exercise. Of course, even animal ethics is very very strict about what type of experiments can be done and all those things. No animal should suffer and no animal should have pain and all those things. So these different type of experiments. Here, this is like a that is a forced exercise. This is a free wheel running. You see, this is a again the rats are on the treadmill. Okay. Now, periodically, blood samples are collected from the rats and then compared with those rats which are not doing exercise with those who are doing exercise, and then what good hormones are produced in the body. Even at the end of the experiment, rats are sacrificed and their hippocampi are studied about neurogenesis, how much new neurons are born in rats which did this exercise. Okay, so like that also, when you are under a lot of stress, you take a walk in a park. You walk for an hour. At the end of walking, you whatever stress is there will be relieved. You have some problem, you find some solution, something. Thinking happens because that rhythmic body movements, legs, hands moving, it will create some sort of electrical rhythm in the brain that it's in medical terms it is known as long term potentiation. So that will help in problem solving, in getting ideas, new ideas, and all those things. Now about food, there are two important points are there as far as food is concerned. The first one is caloric restriction. There is one place in Japan called Okinawa. In Okinawa, more older people are living than anywhere in the world. People 100 years, 110 years. So many people, 100 plus years are living in that Okinawa. So they studied what is the secret of their longevity. So one thing which they follow is that they limit food very only 80% of what you take actually. Suppose somebody needs, I'm just for easy understanding I'm telling, suppose we need 4 idli for breakfast. They take only 3. In dinner, after their main course, they don't take dessert. So caloric restriction, 80%, 80% of your requirement. And then intermittent fasting. All faiths follow. Hindus follow, Christians follow, Muslims follow, Jewish faith. All people follow fasting. Fasting has got a lot of benefits. I said we have billions of cells. All these damaged cells are repaired when gut is free. Suppose you have a breakfast in the morning and then have another meal in the evening around 4 o'clock or 5 o'clock. And then don't take anything from evening to next day morning. All the time, all the damage in the body is repaired. So that's the advantage of fasting. And then there are some foods which are good, like these berries are good, grapes are good, this turmeric, which people have been using for hundreds and thousands of years in India. This is good. And certain types of fish. This is Norwegian salmon fish. It's fatty fish. So these are also good. And so, along with food, music. Uh, when you have some injury and pain, you take some painkillers, some steroids and all those things. If you listen to music, all those medicines are produced in the body. Even in immense, when we do surgery, some of my colleagues who are experts in music, they played music when patient is already under anesthesia and sleeping. But those where music is played, the requirement of painkillers has come down significantly. Yeah, 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 yeah. So meditation helps, and there's a lot of evidence. Now sleep. So sleep is very important. Uh, you encourage children to get proper sleep. Suppose uh, during exams, they study whole night. If there are no exams, still they will be watching movies and all things in the night in the phone and computer and all those things. Whatever they learn from morning to night, when they are sleeping, it will be reverberating in the brain to understand and form long-term memories. When they miss the sleep, that consolidation will not happen. So they will not remember anything. Children who do not sleep, they will not learn anything. The only temporary learning only happens in the front of the brain. Long-term memory consolidation will not happen when they don't sleep. Also sleep, we have 37 trillion cells, and all the damaged cells are repaired. All the damaged cells, all the new cells are born only when you are sleeping. That during that sleep, suppose if you don't sleep, that body repair, recovery, all those things will not happen. Okay, and even in America, there are schools which are considering. Suppose children sleep till 7 o'clock. I'm just giving an example. If children sleep till 7 o'clock in the morning, and if you start the school at 6 o'clock, they have to get up at 5 o'clock and then come early, and their learning is not good. So they are thinking that why can't we start class at 8 o'clock or 9 o'clock instead of rushing them to come early. So these are some tips are there. If you want, uh, we'll share this. Madam and I will share some of this presentation. It will be at VMFT, so you can ask for some of these materials. So these are some of the tips which you can use. Not only children, even adults also can use these tips. So morning when you get up, don't be in a dark room. Just come out and sit in the sunlight. Because body should know that the difference between dark and light. Sunlight should fall on you. Okay. And night when you go to bed, don't keep looking at, you tell students, don't keep looking at the bright screens. Because 10 o'clock, 12, 11 o'clock, 12 o'clock, when they see the bright screens on the computer, it takes 2-3 hours for the eye nerves to cool down. All the processing will be over. So only by 2 o'clock, 3 o'clock only all the processing will be over, and then only they'll get sleep. So same time, same place, dark room, all those things will help, and not to eat in the night. not to eat in the night, because if they eat in the night, midnight, hungry and eat, that itself will take another 2-3 hours to digest. So when food is being digested, difficult to get proper sleep. So they should finish. All of us, not only children, all of us. Okay. So this is how things decline with age, and then with all these lifestyle modifications. Even in elderly people, in America, they did an experiment. Elderly people, those who are 70 plus, they made them do some games on iPad and all those things, made them do some exercises. Even elderly people had growth in the hippocampus. This is a MRI done on the top is before and bottom is after. They showed that even people who are 70 plus also, when they walk and then follow all these diet restrictions, listen to music, do meditation, sleep properly, they had lot of benefits. So I think I'll stop here. Uh, of course, this is this is very very important message which you can share with all your students also. So after you go home, after lunch, you take a pen and paper and then draw 4 lines. One line, how much of your time, how much of your energy, how much of your life, how much of your money you are spending for yourself and for your families and for the society and for the spirituality. So different people, this is, suppose if this is a experiment, this is different people will have different this ones. For example, Dr. S.R. Chandra and me, we spend lot of time with our patients and less time with families. So you also do your own experiment. You take a pen and paper and then draw these 4 lines. Physical, your personal thing, professional thing, family and social and spiritual. And then see how your diagram comes up. And then try to reach this position. This is the ideal thing. So that Okinawa, people living for 110 years, they have purpose in life. They have connectivity. They follow a lot of diet restrictions, sleep properly, exercise, all those things. But they have purposeful lives. I am living for this purpose. I want to do this in my life. Like that, they are all connected, and then they are motivated, and they do things which they like to do. It's not that Japan government will tell them that you live for 110 years or you do this work and all that. They like, they see from all angles what is that I want to do in my life, what I want to achieve, how I want to spend my life. They think and then try to do those things. So that's why they live for a long time. So try to achieve that sort of thing. Now, sir, this is my email. You can take, and then if you want, you can send any messages. I'll just show one thing now. Show the one slide sort of. Okay. Exercise again. Uh, Sir asked me one question that can you hit the child on the head? So let us find the answer among ourselves. Okay, when whether we can hit the child on the head or not. Suppose uh, you are all geology teachers, okay, and suppose I am a student. You are all my teachers. Uh, I ask you a question. As a student, I ask you a question that you see Americas, North America, South America. North America has got United States, Canada. South America has got Brazil, Mexico, and all those things. They're not equal. America is very rich. America is industrialized. America is very sophisticated. Whereas you see poor countries, Brazil, Mexico, they're not doing very well. Whereas you see Europe, Europe has got European Union. Uh, Europe is doing well. You are teachers. You explain to me how the difference is there. How there is a difference between these two. One example is Europe. Sir, for you also. Sir. No, I'm asking one question. You asked me, no, whether you can hit the, suppose I'm your student. You explain to me how Europe is different from United States, North America and South America. Uh, Suppose if I don't understand, you can hit me on my head to make me understand. Or you can explain in a way which make me understand or understood. So anybody, how you will tell me? How you will? No, first thing is question is clear. One side there is a Europe. Other side there is a North America and South America. European Union is there. There is no union of North America and South America like European Union. Everything is different there. As a student, I want to know. So you're all teachers, my teachers. You tell how you'll explain. Sir, we'll start with you. Can you give mic to sir?
I have to explain.
Sir, I am your student.
Yes.
You're my teacher. How you will explain the difference? I'm asking. I'm very innocent. I'm very curious. I don't know. I don't know about world. You're my teacher. So you tell me why it's different. Europe is different. North America and South America are different. I'm asking questions. So please tell how you will explain.
Their living style and culture is different.
Why the difference has come? That is my question.
Because European Union, they traveled the whole world and they were ruling many countries and all. Their lifestyle is different. But this America, they have not gone like that. And they are dominating in money-making policies and etc. That's also.
Okay, any other answer, sir?
They are
Please use the mic. Everybody can hear.
I think because they are connected, they are in a union, they are confident and they are mutually dependent. That's why Ukraine is also trying to get in European Union. That's what I understand.
Thank you. Madam, please pass on the mic. Anybody else wanted to, if you want to tell, please raise your hand so I'll know whom to ask.
To answer that question, one has to know about history. Why America and Europe are rich now is because of their past and the present also. The Europe particularly were colonial states. They exploited other nations to be rich. It is not just about a lifestyle or anything, more about the exploitation system that existed. We need not consider the Latin American countries. We can consider Europe and India. How India became a poorer nation compared with its pre-colonial state, and how Europe or Britain became richer. We can compare like that. And America now, it's also using colonial policies like invasion in Iraq, etc. to become richer. So it's more of a historical question, I see. I think the answer may depend on which teachers are saying it, but I would see it as a historical thing.
So, sir, younger generation is taking over. Younger generation is taking over your generation. Yeah, anybody else want to? I'm a student. Yes, madam. I'm a student. Yeah. Please explain. I mean, I asked you in a class. You're a teacher.
The resources they utilized. The resources, whether the utilization of the resources is also a reason for that. I think European Union, there is renaissance is also there, so they invent new things and they have ability to excavate the world or finding new things, especially industrial revolution. That will affect their lifestyle and they want to sell their products for other world markets. So their lifestyle is entirely different. And I think most of the rest of the world were ruled by them. That is the reason of their underdevelopment of South.
Thank you. Anybody else want to answer? Anything? Anybody else want to add? So, sir, when I ask a question, or this is the chapter which you are teaching, so you can teach. See, we have different ways of. Madam, you wanted to? Yeah. Maybe you can add after I finish. So, yeah, yes, sir. Mike.
I think Europe shares more of common values than Latin America and America, and they are more inclusive. Like after the Second World War, it was concentrated in most of Europe got like economically and their infrastructure. They had to make a new beginning, likewise similar with Japan. So it's more of cooperation and building on a new set of values, inclusive growth, rather than you know, how can we say, like blaming history for something, blaming the past for the present predicament.
Thank you. So, sir, you are teaching me about geography, and suppose if I don't understand, give mic to sir. So, when you are teaching me, if I don't understand, you can hit me on my head. Your intention is good. Your intention is to make me understand. So, when you hit me on the head, what happens depends on number of factors. No, leave it, sir. They will give you, no problem. No, leave it. They'll give you. So, many things are there. One is, are you holding a wooden stick or a metal stick? Are you hitting lightly or hard? Are you hitting on soft part of the head or hard part of the head? And if child is already in a protective way, child will take care of the prevent injury. Suppose child is not able to protect himself, or if after hitting child falls down, while falling down, suppose if there is a glass or a piece of wood, metal, and so many things will decide. So that is one way. The other way is to teach children in such a way that they themselves will be very interested, very enthusiastic to learn. I'll just give you this example. Why I asked you is that. So this is the answer. You see the picture here. This is Europe, North America and South America. So the difference, why these differences have come? Because people from one part of the Africa could walk to the other parts. When wheel came, and then the horse came, and the car came, they could able to go. They could able to go anywhere. Person from Kollam can come to Trivandrum by road. Europe, from one corner, people can go to the other corner and tell. And suppose if it is raining here, if rice is grown here, if wheat is grown here, they will tell the people, next people, you grow the rice like this, you build the house like this, you build a hospital like this. Latitude, longitudinal lines, weather, climatic seasons, all are similar, more similar patterns. You compare that to Americas. What is happening in North America? To reach South America, there is a sea is there in between. In between North America and South America, there is a sea. People cannot swim across the sea and then do business. They have to wait for hundreds and thousands of years for the navigation, for shipbuilding, industry to develop. And also, there will be snow in Canada, and Mexico may be burning. So everything, weather is not same. What grows in North America may not grow in South America. The language, the food, the culture, everything is different. So physical things, geographical things actually matter. They made the difference between America and Europe. Of course, we can explain like that to India, China, why there are so many people in India, why there are so less people in Greenland. All those things can be explained. If you are interested, you read that book. These three things changed the world, according to him. Guns changed, germs changed, diseases, and steel changes the world. Three factors which changes the world. If you are interested, you can read that. Madam, maybe you can come here. Three of us. If there are any questions, we'll answer. Yeah, yeah. Yeah. Yeah, yeah. Yes, sir. Madam.
Hello.
Yeah.
Sir, my name is Ajir Kuti. My question is this: has genetic disorder got anything to do with loss of memory? For example, now they say if the level of plasma is high in blood, it can cause loss of memory or something like that. And it can be treated with neurovitamins. Can you elaborate on that?
Sir, your question has got many parts.
Yeah.
Sir, this head injury, I think I have answered. So I think he is quiet, so he is not asking anything. Now, please repeat again. One is genetic disorders.
Yeah.
Second one is loss of memory.
Memory. Has genetic disorder got anything to do with loss of memory or dementia, some conditions like that?
Dementia.
For example, they say if the level of plasma is high in blood, it can cause dementia or something like that.
What plasma?
Plasma in the level of plasma in blood.
Okay. So one is genetic problem, second one is memory problem, third one is you said some vitamins will recover.
Yeah, vitamin, that is neurovitamins like a homocyst or something like that.
Neurovitamins.
Yeah.
Madam, anything you want to add? This one. First of all, sir, what is the earliest thing you remember in your life? How old are you?
I'm 66.
What is the first thing you remember in your life? You want to carry on? Yeah, sure. Thank you. What is the first thing you remember in your life? Earliest thing?
The earliest thing
As a childhood memory.
There are so many things, but I can't place the first memory.
Okay. So, many of us, we play as children everywhere. We meet so many people, we do so many things. But we forget most of the things.
Yeah.
We have problem as small babies. Problem in standing, problem in walking, problem in running. And as young people, we can play sports, we can do many things. And in old days, we cannot run like young people. Same thing will happen to the memory mechanism. When we are small babies, our hippocampus, amygdala, they are not mature. They are also growing, they are also developing. Like strong bones, strong muscles, strong body, they are also becoming strong. So only when they become strong, like age 5, 6, then only we'll start remembering things. Now, to remember, all our health should be good. Not genetic diseases. Any disease, if there is health, if there is uncontrolled diabetes, if there is a hypertension, there is a cardiac problem, asthma, COVID, any problem, it's not a normal healthy condition. So all things will be impaired, including memory also. If you want to remember, you have to take care of all these things. All the exercise, diet, sleep, meditation, all those things if you do, your overall quality, memory, everything will improve. All of you today, you start writing diary, do all these things for 3 months or 6 months, and then write in the diary how is your condition. You will know the difference. There is no medicine. There is no need to consult any doctor. Your memory will improve, and you will tell same thing to children also. Their memory also will improve. So any disease, sir, not genetic, any disease, cancer, TB, infection, any disease, body functions will be affected, including memory function also. And obviously, when somebody is diseased, like Alzheimer's and dementia and all those things, their interaction, social interaction will be limited. They won't be mixing and moving with people and then having a lot of interaction. All those things will be minimized. When that is minimized, naturally it will affect their learning and memory also. Of course, age is a very big factor. So there are many for degenerative disorders where memory impairment is there. The disease modifying agents, disease modifying lifestyles are all coming up. Madam, you would like to add anything more to his genetic susceptibility and
We tell one Purusha year is 120 years. If you have very healthy genes and a healthy body, up to 120 years you can be normally functional. But there is something called apoptosis. When we age, we lose neurons in a particular fashion. Up to 8th year of age, active synaptogenesis is taking place. 8 years to 30 years, it is stationary phase, no loss, no gain. After 30 years, there is loss. And there is about 250 milligrams of brain volume loss by the age of 120 years. That is normal. You will be functional. But enhanced loss is called apoptosis. That is determined by many factors. Modifiable factors are systemic disorders, but genetic factors are the predominant factors in demanding diseases like Alzheimer's, frontotemporal dementia. They are all genetic factors over which we have no control. They are inherited through genes, where the apoptosis or the dying of cells rate becomes fast. So that leads to these diseases.
So my question is, the fastest train in India is Vande Bharat Express. A gentleman go to the toilet. After a long time, the toilet is not at all open. Sometimes he might have stroke in the toilet. What have to know? I repeat the question again. One gentleman traveling in the fastest train in India, that is Vande Bharat Express.
Yeah.
He goes to the toilet and after an hour he does not open and come back to the seat. What have to do?
Sir, you came prepared to ask these questions before or? So, please remember two things, sir. Sir gave an example that train is moving fast and person went to the toilet and then didn't come out. And he's giving an example that probably had a stroke. Your question is how to prevent or how to treat? Yeah. So, please understand that the event which happened in fast-moving Vande Bharat has got nothing to do with Vande Bharat and nothing to do with speed. Health problems. People say that I was healthy for 50, 60 years. Suddenly I developed this problem. That is not correct. Health problems are not episodic. Arey bhaiya, come, you come. They are not able to see me. You sit down. Why don't you sit? Okay. So you stay in the middle. So health problems are I'll answer that. Health problems are not episodic. Health problems are continuum. The person who had a stroke, the person who had a stroke in fast-moving Vande Bharat started having the risk factors from the childhood. If he had practiced exercise, proper sleep, proper diet and all those things, he would not have a stroke in Vande Bharat. Okay. So two major factors are there. One is health problems are not episodic; they are continuum and accumulation of the risk factors. Okay, that is one. Second thing is somebody may say that I am very young and I am very strong, I am very fit, I play football and all those things. So health problems are not dependent on the might of an individual. Suppose he goes to a restaurant and he develops food poisoning, or if he sits in a hall and then some mosquito bites. So many things can go wrong. Our health is dependent on ourselves, our families, our friends, environment, healthcare systems. Society at large will decide. Suppose if there's a violence in Tirunanthapuram tonight, many people will get hurt. What is happening in Gaza now? So many people are dying. So health is dependent on multiple factors. So I'm sure Government of India, Ministry of Railways must have taken note of concerns like yours, and then in many places I visited all over the world. In many places, in toilets, there is a string to pull. If a person in the toilet has got heart attack, immediately help will the people who resuscitate from heart attack will come immediately within a matter of even maybe seconds or minutes they'll come. Okay, that is one. Second thing is a person who is already had a heart attack or a stroke, very ill person, should tell a family member that I am going inside and stand next to the door. If I need any help, you just come and help me. Like that, you should alert anything. Or you should, if a person is alone, at least you should try to open the door and then seek help for somebody. So like that, some take medicines, or some people with epilepsy, we tell them to have a wristband that if he falls, people on the road will know that, oh, he is an epileptic, he needs this medicine. Now Apple Watch is coming. This watch, my watch will tell if I fall down. It can communicate with my doctor also. If it is connected, it will tell my doctor or family member that I fell down. So Apple Watch saved so many lives. Like that, gadgets are coming. Lot of gadgets, medical apps will come in the future, which will alert people that even fits, when somebody is having fits, there are devices now, they will tell 10 minutes before that after 10 minutes you are going to get a convulsion, so go to hospital, go home or sit down, take help like that. So many things are happening in the medical technology. Yes, sir. Yes, sir. Yes, sir. Yeah. So there are different ways, sir. One is most common thing is removing, and second thing is yeah. So first thing is that we are not removing normal brain. We are not removing a normal functioning brain. We are removing a damaged part. Damaged part. That over a period of time, that that function will be taken over by other parts. So suppose if student is habitually misbehaving, you give TC and send him. Same thing we do. Our surgery is only like giving TC and send them. So one question, madam, online question. So there is a question from there is a lot of people are attending online. One question is about a child who underwent surgery, brain surgery, and has got a problem, and then how to help the child. I think father is asking, father or teacher, I'm not sure, they're asking. So we, without knowing all the details, specific things I cannot answer, but in general, head injury is mild, moderate or severe. 3 types of head injuries. Also, what structures are damaged decides. It's like child underwent surgery, I believe. So it's like a house on fire. If you pour water in the beginning, much of the house will be saved. If you stop fire in the middle, half of the house is burned. If you call the fire service people and then pour the water and stop at the end, most of the house is already damaged. Even if they did their job, house is damaged. House will be burned in 1 hour. New house will not come in 1 hour. 1 hour. New house takes a lot of time, money, effort. So this child recovery depends on multiple factors. But children will recover. Children are growing. They have a lot of recovery, a lot of plasticity, a lot of neurogenesis happens. As they are recovering, growing, many of these defects will be covered. I'm sure. Let us all wish and pray that child recovers. I don't know exactly what is the current condition now, but it's my wishful and hopeful thinking that child will recover. Of course, child needs rehabilitation. Child needs regular practice. If a normal student takes 1 hour to learn, this child may take 3 hours, 4 hours, 5 hours, 6 hours. If this normal child learns this today, this child may learn next week, next month, next year. Depending on his overall condition, he will recover. Wherever the child is, child can seek attention of a neurologist or a surgeon who has operated, also can guide regarding the rehabilitation. So, but if they want any more specific information, they can contact VMFT or they can contact us. We'll be more than happy to help. Madam, if there are any questions.